Great to be here. This is our first Labor-HHS Subcommittee hearing for the fiscal year of 2026, and the first hearing as my new role as the chair. Vice Chair Baldwin and I have served together for several years on this committee, and I look forward to continuing with you in our new roles. I always want to take a moment, too, to recognize Senators Collins, and I know Senator Murray will be here shortly. As the chair and vice chair of the Appropriations Committee, they are committed to regular order and maintaining our track record of writing and maintaining and passing bipartisan appropriations bills in a timely manner. Today's budget hearing is a first step in that process. Secretary Kennedy, thank you so much for being with us today. I know that we all share the goal of improving the health of Americans. This hearing is an important opportunity for the subcommittee to hear from you on the HHS's budget proposal and better understand your priorities for fiscal year 2026. You've taken the helm of a large agency with thousands of dedicated career staffers whose work each day makes Americans healthier and safer and ensures our global leadership in science and biomedical research. In your first few months as secretary, you've made many changes in the department that will lead, I believe, to a healthier America. This committee looks forward to hearing more from you on the details of your proposed reorganization for HHS and working together to make America healthy again. HHS has always worked with Congress when considering and designing reorganizations, and I encourage you and your staff to work closely with us as you move forward. Your fiscal year 2026 budget proposes a reduction in funding for HHS of 26%. I would say ask you to take a careful look at each and every program at the department, and I look forward to reviewing your full budget request, hopefully very soon. This committee wants to work with you on improving HHS so that the agency can move more efficiently and fund the basic science. I'm concerned that our country is falling behind in biomedical research, and this should be a concern for all of us who want to make investments in biomedical research. Investing in that has proven to save lives while exponentially strengthening our economy. NIH-funded basic research is also behind many of the 600-plus new cancer treatments that FDA has approved over the last 20 years. NIH-funded research led to the development of buprenorphine, a medication for opioid addiction. NIH-funded research led to the development of the first overdose naloxone nasal spray, Narcan. For almost a decade, this committee has increased funding towards the goal of finding treatments and a cure for Alzheimer's disease. This goal is very personal to me since both of my parents lived with and eventually succumbed to this horrible disease. These investments have allowed NIH to fund research into a wide variety of potential causes of the disease and build evidence for prevention based on a healthy lifestyle. NIH-funded research of the amyloid protein led to the development of the FDA-approved Alzheimer's drugs in 23 and 24 to slow progression of the disease. All this research is extremely important, and I look forward to working with you to continue to look at diversified Alzheimer's research. Wasteful spending of taxpayers' dollars must end, and I applaud you for taking a hard look at what federal research dollars are funding, and I encourage you to ensure that the fiscal year 2025 funding that Congress has already appropriated is spent in a timely manner, in particular for the vital biomedical research which could lead to life-saving breakthroughs in science. Too many families are waiting for a cure, as you know. We have a responsibility to make sure their taxpayers' dollars fund that research. You and I have talked several times, and I appreciate it so much, about the importance of the NIOSH coal programs in West Virginia and how the work conducted by NIOSH in Morgantown is unique across the federal government. I'm pleased that you brought some of these specialized NIOSH employees back to work earlier this month and then just last week reversed their rifts so that their return to the office will not be temporary. Thank you. Your decision to return NIOSH staff to the office meant that the Firefighter Fatality Investigation and Prevention Program could issue the final report on the December 27th, 2020 fire that killed a 30-year-old firefighter and injured 3 others in West Virginia. Senior Airman Logan Young was one of many who responded to the Carneysville fire. I'm glad NIOSH was able to finish their investigation and issue recommendations and final report. While your action last week was a good step, there are still other divisions within NIOSH with specialized staff who conduct essential, unique work. I support the President's vision to right-size our government, but as you and I have discussed, I don't think eliminating NIOSH programs will accomplish that goal. I encourage you to look at this closely. West Virginia, my own home state, continues to rank above the national average in both new cancer diagnoses and death. We are thankful for the work performed by the CDC National Center for Chronic Disease Prevention and Health Promotion, and I look forward to learning more about how this important work will be continued under the administration of a healthy America. Substance abuse challenges also continue to be a real problem facing West Virginia and the nation. SAMHSA funding has played an important role in West Virginia, and I want to understand how the budget proposal would impact my state. I look forward to learning more about that from you today. I will say there was a bit of good news, I believe, last week when the national statistics of overdose deaths did go down. Rural health care is a top priority for this body. CDC data shows that rural Americans are more likely to suffer from higher rates of diabetes and are more likely to die from cancer, heart disease, and stroke than urban Americans. This is unfortunately true in my state, which also leads the nation in diabetes and heart disease. Improving rural health outcomes goes hand in hand with investing in the healthcare workforce to meet the physical and mental health challenges in America. HRSA has been a trusted federal partner on rural health issues for decades. HRSA has funded critical rural health capacity building and other initiatives across the country and administers the healthcare workforce programs that help bring medical providers into local communities. You have proposed moving HRSA into the new AHA, and is that how I say it? AHA. I would like to learn more about how your budget proposal would invest in rural America. We have a difficult task ahead of us, but it's my hope we can and will come together, just as we have done in prior fiscal years, to use our limited resources in the most efficient and effective way. So, Secretary Kennedy, I look forward to your testimony, and I now will yield to my, or not yield, but turn the microphone over to Senator Baldwin.